I chose to do my presentation on ethical concerns for counseling adolescents and young adults who self-harm. So just an overview of this topic. The population I chose is both adolescents who are under 18 and young adults who self-harm. So those under and over the age of 18, and ethical concerns connected to this population. So just a quick definition of self-harm. It's defined as any deliberate but non-suicidal harm to self, such as cutting, scratching, burning, self-poisoning, or any other deliberate harm to the self. And it can occur on a continuum from less severe to something that results in drastic health concerns and can result in varying degrees of psychological harm and physical harm that may be unintentional. And studies have found that between 5 and 15% of young people have a history of self-harm. So ethical issues connected to self-harm. So one would be confidentiality when treating minors, when you might need to break confidentiality, why you would do that, and really determining the level of danger that's occurring for an adolescent. If you learn that they are engaging in self-harm, where do you kind of determine the level of danger to themselves? And then another issue is pertaining to college students. So this would most likely be someone who's not a minor, so someone 18 or older. In 2011, the Department of Justice, they altered Title II of the Americans with Disabilities Act, and they actually removed threat of harm to self from the direct threat standard on college campuses. So this potentially limits actions that colleges can take when they're working with and responding to students who threaten self-harm. So there's an interesting article about behavior intervention teams and how this change kind of limited them in ways of what actions they could take. But schools also used to be able to sanction or dismiss students who they thought posed a direct threat to themselves. So this might be them engaging in self-harm. But actually now that this was taken out, colleges cannot freely just dismiss students who might be engaging in or threatening self-harm. So there's kind of two sides of it. So the case I'm going to focus on today is a hypothetical case with Carly as a dance movement therapist working in a middle school for students with behavioral concerns, working as part of a treatment team with a school counselor and a social work intern and herself, so the three of them working as a team, and a client named Chelsea, who's 14 years old and has been doing individual movement with Carly. And Carly notices that Chelsea has both scars and newer wounds on her forearm that she hadn't noticed before. They appeared concerning to Carly, and when Chelsea saw Carly looking at her arm, she pulled her sleeves down, refused to answer any further questions about it, and saying, "I only talked to Gwen, the social work intern, about that." So ethical concerns here, issues within the treatment team and information sharing. Carly was surprised that she had not heard about this from Gwen. Gwen had not shared it with them, so that was a concern. And then another concern for Carly would be what qualifies as a danger to self and would necessitate a breach of confidentiality for Carly or for the school counselor to let Chelsea's parent or parents know what was going on and that she was self-harming. So I'm going to use the Remley and Hurley ethical decision-making model for this. So identifying and defining the problem. So the first step I would think would be to talk to Gwen and the school counselor. Is what Chelsea's saying true? Did she really tell this to Gwen? What are the missing facts and details that Carly is not, this is all heard from Chelsea, so she needs to talk to Gwen. The stakeholders, all staff involved, including Carly, Chelsea's family, and the school itself. And the issues really are, is Chelsea self-harming currently? Does Gwen know details about this? Why wasn't it shared with the treatment team? Are Chelsea's parents aware? And should confidentiality be broken in this case to let them know what's going on? The second step would be involving Chelsea in this process. So bringing her into the discussion, gathering more information about the history of self-harm, doing a suicide risk assessment, and letting Chelsea know if she hasn't been told already about the limits of confidentiality and the organization's policies. reviewing relevant codes and professional literature. So from the ADTA Code of Ethics, that DMTs need to inform the client of their rights and the therapist's responsibilities. So this includes confidentiality and its limits. And also that the DMT needs to assess for client risk of suicide, and introducing clinical measures to protect this client from serious danger to herself, which may include a breach of confidentiality. So Carly and her team would need to assess what is the serious danger to self threat, whether it would be enough to breach confidentiality. And then the American School Counselor Association ethical standards. There's a standard about breaking confidentiality, and then a duty to warn others if the student is a danger to themselves. And then does the school counselor have the right to contact her parents? Kind of where is the line there? So considering principles and virtues, so Carly strongly values the therapeutic relationship that she has built with Chelsea, but she also wants Chelsea to be safe, obviously, and she's fearful that she might unintentionally cause harm to herself. Tuning into her feelings, she feels uneasy that Gwen may have known about Chelsea's self-harm and didn't bring it to the team. But she also doesn't want Gwen to get into trouble because she's still a student, she's still learning, maybe she didn't know. Maybe she was keeping this secret for some reason. And then concern for Chelsea's safety, but also a lot of her own anxiety in her body because she has never worked with a student before who was self-harming, and she's just not sure what to do or how to proceed. Consulting with her colleagues, her supervisor, Carly would talk with her supervisor, who's the school counselor, who could speak with Gwen, or Carly could speak with Gwen, or they could all kind of talk at once about what Chelsea disclosed to her, or if she really did disclose it to her. And then both Carly and the school counselor using supervision to talk about this situation and their feelings about it with their supervisors. The sociocultural context. So one of the articles, Frosch and Moyer, they brought up this issue that self-harm might signal issues related to gender, race or ethnicity, socioeconomic status, sexual orientation. So is this pointing to some issues with her trying to figure out her identity, or is that might that be the cause of what's happening? And then questioning whether it's somehow part of her family's culture, just kind of figuring out where this might be coming from. So identifying the desired outcomes and possible actions, so they could notify Chelsea's parents or continue to assess the situation and not notify them. And so therapeutic relationships might remain intact if they don't contact her parents, or Chelsea could intentionally or unintentionally cause serious harm to herself, and the parents could take action on the school and the staff involved. So those are some possible actions and outcomes. So choosing a course of action, acting on that choice. So together, the school counselor and Carly decide to meet with Chelsea, along with Gwen, to encourage her to let her parents know about her self-harm. Chelsea ultimately is able to agree to bring them in for a meeting where she discloses her history of self-harm. Her parents take the school counselor's recommendation to seek outpatient therapy for Chelsea because Carly and the school counselor are not, don't feel super competent in dealing with the self-harm and think that she should be referred out to outpatient counseling. And then afterwards reflecting on the experience. So maybe the school counselor would decide to create a clear policy about self-harm so that in the future they're better able to make decisions about what to do when a student reports self-harm, whether to break confidentiality or not. And then both she and Carly and Gwen could talk about the situation in supervision just to reflect on their own feelings about what happened and the decisions that they made. So just a quick discussion. So the counselor scope of practice in this situation, just wondering, is the counselor part of a treatment team? Does the counselor really have enough knowledge about treating adolescents or young adults who self-harm, or should they refer out to someone with adequate competency and experience in this area? And then what is the organization's policy on confidentiality and sharing with parents? What action is taken in this situation really would depend on if the school has a policy that should be followed, or if this was in an outpatient setting, or like a partial hospitalization, what is the organization's policy on this? some places may share everything with parents, some may not, and also depending on the adolescent's age. So potential rule boundaries in this situation specifically, if Carly or the school counselor was serving as like a coach or an after-school activity leader, what would be kind of the boundaries and the lines drawn there? Like if they were to hear someone say something, while playing a sport or in an after-school activity where maybe they weren't acting as in the counselor role at that time, that would might be an issue. And then multicultural concerns. The Fresh-Moyer article also brought up that for some, what might look like self-harm could actually be a cultural practice or rite of passage for a certain cultural ethnic group. So really just investigating a little bit more and getting more of an idea of what's going on before immediately taking action. Legal factors, so it would be confidentiality, the threat of harm to self or others, and limits on where and when this can be shared with parents, with administration, any other parties involved, the legality of that. And then finally, self-care concerns. So really the therapist's own physical and psychological health when helping clients in crisis. So if a therapist was seeing many students or many clients who self-harm, dealing with the emotions that might come up when working with such a young person who's engaging in self-harm, how that might impact the therapist in doing this work. And these are references that were referenced in this presentation. Thank you for listening.